Welcome, I'm Patrick Ryan and I'm here to talk about yellow fever. Yellow fever is a virus transmitted by the bite of the Aedes and Haemogogus mosquitoes. These mosquitoes chiefly reside in tropical and subtropical jungles and forests. The most common transmission cycles are monkey to mosquito to human and human to mosquito to human. The most dangerous transmission cycle is when a person who's infected leaves a rural area and goes to an urban area that has a high mosquito density and a population with low or no immunity. The WHO identifies yellow fever as a high-impact, high-threat disease with potential for wide international spread. When someone is bitten by one of these mosquitoes, the virus will incubate in their body for 3 to 6 days. Many will show no symptoms. Those that do will report fever, headache, nausea with vomiting and appetite loss, and body aches, chiefly a bad backache. Usually these symptoms will subside in a few days. A small number of patients will see their symptoms subside for about 24 hours and then come back with a vengeance. There'll be high fever, kidney and liver damage, jaundice will ensue, giving the skin a yellow tint, and it gives the disease its name. There will be bleeding from the eyes, the nose, the mouth, and internal bleeding in the stomach. About half of these patients will die in 7 to 10 days. And there's no antiviral drug cure for yellow fever, but early detection and treatment of the symptoms of dehydration and kidney failure will lead to better outcomes. The WHO and its partners at UNICEF and Gavi, which is the Gates Foundation Vaccine Alliance, recommend, among other efforts, widespread vaccinations. A vaccine is available, and it's the single most important measure for preventing yellow fever. It's safe and affordable, but not available everywhere as demand outpaces supply. A person that recovers from the virus will have lifelong acquired immunity. Mosquito control is also a vital step in curbing the incidence of the disease. Eliminating mosquito breeding grounds and the use of pesticides to kill adult mosquitoes and their larvae will cut down on the spread of the virus. Now, the difference between the way the US and other countries are addressing this issue is stark in that the US doesn't really address this issue. There hasn't been an epidemic of yellow fever in about 100 years. Mosquito control is a big reason for this. Now, the Aedes mosquito is present in several US states and territories, including Puerto Rico, where it's believed to have played a part in the recent Zika virus. Changes in climate may increase the mosquito's habitat and increase the possibility of wider spread of the virus. As for regulations, the US doesn't require foreign visitors to show proof of vaccination, so someone could carry the virus across our border. This, combined with a growing mosquito population, could pose the risk for future outbreaks. Finally, this subject is of some concern to me personally, as I look to be moving to South Florida possibly in a few years. If I do go there, I would certainly get a vaccination as a precaution. Thank you for your attention. Have a great day.